Lagos doctors, not strike, sack. Yes, there are about 788 of them. Well, we'll get the proper figures maybe now, as we're joined by Dr. Adebowale Adekoya, who is a consultant nephrologist and the chairman, Medical and Dental Consultants Association of Nigeria. That's last week, right? Yeah. All right, thank you for coming on this morning.
Yeah.
Well, yes, so much is out there in the news about why doctors were sacked, but from what we understand is that there was insubordination, the strike was illegal, and the reasons went on. Why did the doctors act that way to get themselves sacked in the first place?
Well, thank you, Chibolin. First of all, I must say that it's quite unfortunate that we're all sitting here discussing doctor strike. It's bringing us back into the dark age. But, be that as it may, it's already happened and it's in the news, and we just have to look for the solution. It's happened already because I think there is a breakdown in communication somewhere. Because if you ask me, my personal opinion, this is just a storm in the teacup. Probably we're dealing with a tempest in a teapot. It's actually nothing on ground to warrant this grandstanding. I think Nigerians will realize that we're talking about simple agreements that we had with government, and we went back to work. You all heard about the strike when doctor strike happened. That was called off in February last year. And for 13 months, we worked around the clock to get this agreement implemented. That process broke down. A warning strike was called. And Nigerians knew about the warning strike. It was like talk of the town. We went on warning strike just like many other professionals and labor bodies. And we came back. And we were taken aback when we resumed duty, and we could not actually function because we're being stormed every day with queries. And I remember, as the leader of the association, I personally went to the management and said, look, because those queries were coming in the mornings, and what that meant was we would call out our doctors and say, please, there's this query, try to calm them down. But it was also distorting duties. So apparently the government were actually putting in strike when there was no strike.
But which of the query? I mean, it comes across as though there was more than one.
Yeah, that's what I'm stressing. The first one came, and I remember we wrote them as an association. We got a reply that we didn't write you. We wrote your members. Let them reply, and we met with our lawyers. You know, we got to seek information on this. Said, look, you went on legitimate strike. Why will you answer queries? And we also got in touch with our parent body, the National Medical and Nigerian Medical Association, and they said, don't answer these queries. And we felt bad that we were queried when we actually knew that the process of negotiation broke down before we went on this warning strike.
Yeah, but they say that concerning the legality of the strike, that your notice came, I think, 24 hours, and then you went on strike.
I'm not ready to go into technicalities of all this, but I'm sure Nigerians out there are actually saying we want to be alive, we want these doctors back on their duties. But for the purpose of clarity, let me inform you that that agreement that was signed and the Congress that came after that were clear enough that, look, we're suspending this strike. Oh, you're not assuming that doctors are going to be that stupid. When you promise them something, they will now say, okay, we've called off a strike when you've not been paid. We suspended that strike. And I'm finding it difficult to know which part of the word suspension people cannot understand. You have the right to start all over again if there is a breakdown in communication. And we've not even told that part for 13 months. And even in the interim, that 13 months, we had a meeting, not really a meeting, a dinner where the governor was present. And we promised him there would be no strike, even in the middle of all that. That showed you the sincerity of purpose from the people you're dealing with. And I'm sure there are families out there who have brothers, sisters, children, uncle, who are doctors. And by our calling, you know, our primary responsibility is to our patients. And we want to be out there saving lives.
Well, there's no doubt we must have to go back to the issues here, because it looks like if you say someone somewhere has misinformed the people, some section of the community is saying that the doctors are so insincere and insensitive to the plights of people. What exactly is the demands by your doctors?
In 2009, comments was approved for doctors, and we've been here to discuss comments before, approved for federal and state doctors. We operate a federal system of government. So if somebody is now here telling you, I wasn't part of a federal agreement, then as well, you're probably clamoring for anarchy. okay? Because we know that no decision has been taken by federal government without probably carrying along any sector of the economy and its members. So these were paid and was paid to federal doctors and paid to some state doctors, and it's on record today that Ekiti State started it off. And of course, you're not going to class Ekiti State as one of the rich states in this country. And many other states followed suit. And we started the battle. And we were on it until August 2010. And there was a strike when the whole thing broke down. Because the message we were getting then was, we're not going to pay. It wasn't our plan, it was a federal plan. And we called the attention to the fact that many people were paying and they've actually enjoyed the arrears. And we didn't know our sins for working in Lagos and working with Lagos. So we went on strike in August, and it was unfortunate because that strike lasted till December, if you remember. And important people in the society from within and outside Lagos intervened, and that strike was called off. Then agreements were not met again. People started saying, no, we didn't know about this. Where are the papers? Doctors, bit out people were, and we just felt, oh, you agree with us. Then we had nothing to flag as agreement. So said, okay, we had to go back on strike. Thank God we gave them enough notice for that. And that started in January. And at that point...
That is with this one?
January,
okay.
Last year.
Okay.
At that point, I'm sad to inform you that a lot of people left the services of this state. But some of us who were born, bred, and buttered there, and we know we have our parents, children, and family members here, we tried to stay back. We're not going to be intimidated.
But did you give the government 24... What kind of notice did you give to them? Was it a 2-week ultimatum,
the
a 1-week
strike
ultimatum?
Of January 2011 came with the normal 14-day notice.
What about
this one? There's nothing like that in question because the strike was suspended in February 2011, and after that time, 13 months after, the agreement has not been fulfilled. In fact, not about fulfillment of the lines and letters. We're actually reneging on it.
Well, allow me come in here because it's all a matter of semantics. I remember then when ASU, whenever they go on strike, they say, or Labour specifically, they say the strike can be called off as a suspension. But anytime there's going to be any kind of resumption or resumed strike action, they also give some kind of ultimatum. So why didn't you give that ultimatum?
You're mixing things up. You might want to know that information is not completely true. I'm not aware. Because if you talk about some other labor struggle we've been in it, where you say I suspended my strike, then you now, what method are you using? Look, I stand to be corrected. I'm not a lawyer. If I tell you I suspended discussion, I didn't tell you I've ended the discussion. That means probably I'm going to the restroom. I'll call back. I'll continue the discussion. And
so
I will discuss.
So that means without any warning, you can just come back and
warning is
down
that
tools.
Warning came, and I'm glad to inform you that warning came weeks before before the warning strike. And I challenge whoever says we have not given any warning to come up here and we'll show the letters that was sent to them after the ordinary general meeting. Okay, they were informed that the House met, people were not happy. The Congress decided there will be a warning strike from so day. So I don't know which warning we're talking about.
So with this strike now, this last one, when you resumed the suspended strike, was there any need to notify them that you were going to resume the strike?
Come again. I actually got you right, but I want you to take it.
When you resumed the warning strike, you suspended the strike.
Yeah.
So when you were about to resume, just as they asked, were you supposed to notify them? I'm going.
No. I got you, but I will just allow you to say it again because to me, it's not funny. If you say, I've gone in a warning strike, warning means there is something coming after if these issues are not attended to. So I don't have to now tell you that it's like, look, we are employees. We are not supposed to be grandstanding. We can only appeal. And that was what we've been doing. And even that unfortunate, and I call it unfortunate 3-day warning strike, came at the last resort. It's not the practice. You've been in Lagos for how long?
Okay, so which letter were they referring to that your notice came to them 24 hours before you went on this last strike?
I want them to bring that notice.
There was no such notice from medical?
Well, I'll be glad to see that notice. Maybe I don't know about it. But because I knew earlier I was coming to the court of public opinion. I came with a bag full of documents in my car. But this is not a law court. As I speak with you right now, our colleagues are in court with our lawyers and government lawyers on this at the industrial court, the session this morning.
Sir, two things have struck me in your presentation so far. The first is that, this is a storm in a teacup.
Yeah.
And that, or a tempest in a teapot.
Yeah.
Those were your words. And that this is a breakdown of communication somewhere. Yesterday, in our chat segment, we likened this to the fight of two elephants. Where is the place of the grass here? Because what might be a storm in a teacup to you is actually somebody's life hanging in the balance. You mentioned that this is not the norm for Lagos State doctors to go on strike, but so far since 2010, we've counted at least 3 different occasions where you've gone on strike. The first one was very lengthy, from August 2010 to December 2010. By January 2011, another strike had been started to February. And then again in January this year,
April.
Was it April?
April, yeah.
There was a warning strike as well.
Yeah, April.
Again, because I remember very clearly that somebody had to go to the hospital. Was it sometime in
not Lagos?
There was not Lagos
Yeah,
State,
not Lagos,
but this is the 3rd time.
Yeah.
Where is the place of the patients here?
I'm happy you ask these questions again and again. I want to inform you that sadly, the doctor is also a patient. The doctor's wife is a patient. So the 2 elephants here, actually the government and the public, and the grass here is the patient and the doctor together, because we are in it together. That's what I mean. And that's been the norm on which we've practiced. And people who actually read the lines of the Hippocratic Oath, we know that is it. So if you see places where doctors don't go on strike, definitely not in this climate, we're talking about Europe or America, doctors have no business going on strike because things are in place. You don't go back to tables 3 times and get discussion breakdown 3 times in such places.
Okay, now let's take a look at some of the issues that you've raised. My colleague has asked you what exactly the issues are. You've raised the issue of conmess again. Remember that we asked the Lagos State government while they were here, and they claim, in fact, they've gone great lengths to publish what it is that they are paying the doctors, what the federal government is paying, what they're paying, and what the amount, the increment is in terms of percentages. And we've also seen that. Was that document a lie?
There was a meeting with the House of Assembly, and one of our colleagues challenged them because he's a chief imam, and he asked them to swear if that document were not to be a lie. And nobody could. Everybody was present. My sister, that document was falsehood. And I personally made a memo to the governor to call attention to it that was falsehood. And I got privileged information which I cannot disclose on this on here. That, look, let's solve this problem first. Because if you give false documents, we are ready to pursue it to the last letter.
But
and
have salaries, sorry to cut
Yeah.
you there, have salaries been increased since the meeting you had in 2010?
yes.
They have been.
Yes, and for information, salaries and wages get increment. With time. Not only because of comments, across board.
But can you give us like a percentage? Because they claim that they are actually paying conmess, naira for naira. I'm using their words kobo for kobo, but that there are disparities on certain levels. That maybe maybe level 12 step 1 is different from level 13 step 2 or something. I don't know how it is, but they claim that what the differences are really, really minute, not enough for you to go on strike.
My heart bleeds. Most times people speak words that are in clear contradiction. If you say the differences are minute, and at the same time you're saying you cannot pay, then you're saying the simple thing is difficult for me, but the more difficult thing is easy for me to execute. What's the sense in that? What we're saying is that we agree with them perfectly that they are minute, and you're forcing me to bring out figures, and I will this morning. Because tempers are rising. I sad to inform you that the issue of house officer, please read my lips and mark my words, that have been raised. It's unfortunate, but if you want to hammer it that we don't want to pay house officers, I'm telling Nigerians right now that they're paying house officers teaching allowance everywhere. And I've had people coming on here to say house officers are medical students. You don't have to be a doctor to know that was another deception. House officers are doctors who have temporary license to practice. And as house officer in the University of Ilorin, teaching hospital in the 90s, I trained medical students. Some of them are very senior colleagues in the profession today. And that is not the issue. The issue is we're talking about 1.4 million as the total amount required to pay all house officers. And remember I was in Abuja with one of the very senior senators, and I was telling him last week, he said it's not possible. I said, look, I've sent this document to government. you need just 1.4 million. And I volunteered during that meeting that I'll pay this money. To restore sanity, if what you need to pay the house officers to clear this problem is meager 1.4 million, because teaching allowance for information is 9,000 naira. House officers, 9,000 naira. If people don't understand what doctors are going through,
9,000 naira?
I'm telling you, that is teaching allowance. You have the document, want me to go out there, I'll bring it, I'll put it on this table. This is why we've not joined issues and gone to the trenches to publish salaries of our colleagues and people in newspaper, because we know the consequences. Those who did not are now seeing the after effect. Dr. Otulano was kidnapped days after that document was published. This is her 6th day in the hands of her captors, and she had not been released. They are demanding for 100 million from a doctor that doesn't have a saving of 100,000. That is the risk to which this crisis has exposed doctors all over this country. And people are actually packing their bag and leaving in hundreds to neighboring countries. If we don't need this in the board, we have before us a keg of gunpowder. We are sitting on it.
Okay, when you say, you have said you brought the notice of that false document which was published to the attention of the governor. Yeah. Did you get any response?
I got a response, but my interaction with them was not official, so that's a story for another day. I'm not here to be talking about...
Okay, because it comes across. Okay, let's assume, the governor didn't want this. He didn't want this sack. Could anything have been done if the medical guild perceived that maybe there was communication gap, maybe he was being fed with something that is not right? Did you notice anything, and did you attempt, even if it's unofficial, to see if you could actually reach him and tell him what was going on?
Yeah, by the position we occupy, we have the privilege of being close to the government. So, and I can tell you categorically that, look, even if I'm not saying this, people out there know that we have a governor with a human heart. Where did things go wrong? And I said it on another TV station yesterday. That is what is called the Council of Ahithophel. Somebody comes here, you've seen a lot of government people come here to tell you are paying figure for figure. And people get to write us and say, please, counter the argument. I say, look, one thing is constant in life. Let the falsehood start up and start running. The day the truth stands up, it catches up with it and overtakes it. Let me tell you what I mean by figure for figure. And you'll be amazed this morning. What that means is that you want to take to government and say, because the last time we met, you say, are we owing these doctors? The guy doesn't even know he's owing us. And the truth is that somebody demotes you, they have a figure, the comments table is not about percentage, it's about the table. And now say, let me give an example. Chamberlain is supposed to be on 14.9. I want to pay him figure for figure, naira for naira, like the politicians come here to say. I'll demote him to 14.1. So that if he was supposed to earn 7 naira, I'm now paying him 3 naira. Then I'll tell Nigerians I'm paying figure for figure. That's ungodly. And we're not going to go into the papers to publish those things. The only thing we can do is what we're doing right now, keep negotiating with them. If it breaks down, we'll use the machinery approved by international labor law, which is this strike.
If we're to get you right, you said the steps were reduced.
People were demoted.
So as to be able to
pay figure for figure.
To be able to pay a certain figure.
Yes.
So it doesn't mean, let me just try and get this very clearly. What are you trying to say is that if I was demoted to, say, level 12, step 1, from maybe level 12, step 5, I will still get what I'm getting at my level 12, step 1 is what's actually COMERCE approved, right?
Yeah. No, you got it right.
I will get what COMERCE
approved.
But the problem is
taken you back 7 years.
I have been demoted.
In your career. There's no problem with that, because I've had people call me and say, look, Adekoya, tell your people to resign and go to that place. I say, yeah, you got it right.
And this happened across board.
Across board, but they're going to leave. They will leave without pay slip. I'm sure you do that in your profession too. If you're going to leave channels now, you're going to maybe BBC or CNN, you're going to leave with your last pay slip and you're going to read Chamberlain step this, level this. And people say, look, you correct this. You know the funny twist to this. Again, in terms of figure, because this is why I'm here. To correct that, some people have given the governor the impression that it will not be able to tar roads, it will not be able to build schools. And I want him to tar roads. We want Lagos to move on this fast lane. But to correct that, you need less than 21 million.
Are salaries the only thing disturbing
No,
doctors?
it's not only salaries. The issue of COMERCE came up alongside with the other pressing issues. And I want to gladly inform you that this government is attending to infrastructural issues. And I was on here the other time to play glory tribute to the Renal Center that we've just built. And we're about commissioning it. And as I speak with you right now, we've been placed on a very, very high cadre in terms of renal care services in this institution, above many other big centers in Nigeria. But we're losing all this. Why? Because somebody's misinforming somebody somewhere.
All right, what do we do to sort this problem out without going to the courts?
Well, I cannot answer that, because right now, we're in court this morning. We don't have the resources to start pulling lawyers here and there. I don't want to mention figures, but you know what it takes to get SAN. You don't want to go to court against a government that's going to bring 10 SAN, and you're going to bring a lawyer that just finished law school yesterday. So it's a lot of money which we don't have. And our check-off dues have been seized by government the moment they perceive that we're going to go on this strike. So we don't have that money, but what we're doing right now is to say, look, we are defenseless civilians. We want to go back to the negotiation table. As I speak with you right now, I have my own letter of withdrawal of service as honorary consultant in last week. And hundreds of doctors have their letters with them. And what that means is that hospitals are locked up. And somebody came on here and told you, we've recruited. And the patient called me and said, I have your clinic today. I said, yes, I've been sacked. Why don't you go to the clinic and meet the new doctor? And the patient was wailing on phone. I'm in the clinic. The whole place is locked up. Take your what I'm challenging the press to do now is to do investigative journalism. Take your cameras to Lasuth and see the whole place is locked up. We want those places open so that people can get there.
Who do you think has been peddling all those lies to the executive? Because almost everyone, even the Commissioner for Special Duties is a medical doctor, the Commissioner for Health is a medical doctor. Don't they understand all of this?
The Commissioner for Special Duties is a medical doctor. He's a friend. He's out there. He's coming in right now. But the issue is that these are people who don't have the real information. We're in the system. But by being in the system, you cannot tell me my shoe is pinching you in the legs. It's not possible. It's my own leg. So when we give you information, if you need to cross-check, you get back to us. We're leading people. And when information breaks down, then you come to damage control and you manage it. You don't then come in a democratic era with this type of big stick that you're going to wield. You're going to sack over 1,000 doctors and put the lives of millions of people in danger. In this very trying time for Nigeria.
On an average, how many doctors to one person in Lagos?
That was a figure a friend of mine was trying to work out with me on phone while I was driving here. And I told him, we were working it out and I was getting confused. I said, my brother, don't get confused. Even Nigerians don't know how many people are Nigerians. But let's work with figure. So, like right now, you're telling me 788 doctors were sacked. But you and I know that over 1,000 doctors probably will have been sacked. Nobody has the figure. But it's very pertinent to know that as we operate right now, we're operating nowhere near the WHO requirement of 1 doctor to 250 people living in any locality. Lagos is trying to be New York, and very soon we'll be there. In New York, it's 1 doctor to 360 people living in the city of New York. If you put this government figure, let's work with our own figure, of recruiting 373 doctors, that means my calculation is wrong. Working by the flagged population of Lagos of 20 million, do your own calculation, it comes to like 1 doctor to over 50,000 Lagosians. I'm not going into details of that because we do that, so this is arrogant, are you playing God? Nobody wants to play God. What we're saying is that you have to go back to the negotiation table. If there are T's to cross, if there are I's to dot, let's do it on the table. More so that we know the financial implication is not going to hurt you. And I told you, we've told them that if you have problems, some of us are ready to pay this money so that there will be peace. We call it start dose in medicine. Then continue the maintenance.
So you're willing to shift ground at some point?
We've shifted grounds at many points. The issue is that what we are saying is that we are even ready to bend forward and backward to ensure there is peace. I told you I'm not happy to be here this morning.
Doctor, sorry to cut you short, but do you agree that doctors should be among those who go on strike? Don't you think that their services are as essential as those of security agencies? No matter how aggrieved a security officer feels, especially a government one, he's not allowed to go on strike.
Yeah, I see where you're coming from. And again, I see your feelings. You're a Nigerian who wants the best for this country. And I'm actually in your shoes. And it's unfortunately the pressmen that were there the day I made this promise on here didn't really give it wide circulation. I promised this government that during our own time, as leaders in this profession, there would never be a strike. There would never be a strike. That's because we believe that doctors should not go on strike. But I put the proof that night. I said, but please, Mr. Governor, ensure that welfare is taken care of. We're leading people. You don't just go meet them that, don't worry, they've demoted you, there will never be a strike. What kind of leader are you? I prefer to resign and go back to my house. I just told you when I came on here that I'm probably looking for a job in channels. That's what it will come to if you cannot lead people again. I will not be like a doctor, because these letters were signed by doctors. I hope you're aware of that. Medical doctors signing doctors to be sacked. I told them, yo, if the governor has given me that job, I'll resign. Because I'm not convinced that these people should be sacked. We have a negotiation going on, it's broken down. If I've sacked you, imagine somebody sacking all the nephrologists in his hospital. At a day that was supposed to receive gifts from a donor organization. Imagine somebody sacking all the nephrologists in his hospital. At a day that was supposed to present quarterly report to international community that promoted Lagos as one of the best in Africa in healthcare delivery service. So we are going to write that report in what sense? We have to move on. We have moved very far in Lagos.
All right,
this strike must be stopped.
Just for information purposes, I mean, those that have been recruited, is it 373 of them, are they on the same level with those that have been sacked?
Leave that to the politicians. I'm here to talk about why this must not go on. Because look, we are playing with figures and emotions. Somebody says we have recruited 737. I mean, don't let's go into that. You're making people look like they don't even know what they're doing. 373 doctors to manage 20 million people, Lagosians, and they said the recruitment is ongoing. And for information, these people will not report because NMA is on top of this. 24 hours, ultimatum given by NMA expired yesterday. So there's an NMA meeting tomorrow. And the consequence of that, I don't pray for it. Okay, the national body, in the papers today, you've read it, they want to shut down your country. You don't want that, I don't want that. And it should not happen in our own time. We must go back to the negotiation table, we must tell ourselves the truth. And that's the way it should be. If we leave the negotiation table, sit smiling and hugging each other and one another, then we've not done anything. We must tell ourselves the truth. We don't have to listen, but let's do it. It might not suit you for political purposes, but let's do the right thing.
All right, then, do you think there will be a need, just in case, for the governor to meet with you all and get to hear your side of the story before negotiations start?
As I speak with you this morning, I see my phone calls to them. They're picking it, and I can assure you, now that they're picking it, I'm happy. So that means at their own end, they're also working out ways. Now everybody's realizing that, oh, somebody's telling us lies here. Now somebody tells you, we are not owing them. I don't know why they're on strike. Look, your baby is crying, and you're telling me there's nothing wrong with that baby. Are you not a bad parent? There was something wrong. Attend to that baby. And you just said you've gone on strike 3 times in a spell of how long? There must be something wrong somewhere. You can't just not be owing them and they're going on strike repeatedly.